to hand things over to Assistant Attorney General Greg Hardy.
Good afternoon, everyone. As Catherine mentioned, my name is Greg Hardy, and I'm an Assistant Attorney General in the Healthcare Division of the Attorney General's Office. Catherine, if you could go 2 slides forward, please. Thank you. So today, I will first discuss the Attorney General's Office's investigations into various companies and their roles in the opioid crisis. Then I'll discuss the settlements we've entered into with some of those companies, including 5 new settlements with Teva, Allergan, CVS, Walmart.
It's hard to hear you. You're on mute.
Oh, sorry about that. So as Catherine mentioned, my name is Greg Hardy, and I'm an Assistant Attorney General in the Healthcare Division of the Attorney General's Office. Today, I'm going to be discussing the investigations that the Attorney General's Office conducted into various companies and their roles in the opioid crisis. Then I'm going to discuss the settlements we've entered into with some of those companies, including 5 new settlements with Teva, Allergan, CVS, Walmart, and Walgreens. After that, I'll discuss the sign-on process for those 5 new settlements. And then last, I'll briefly touch on the municipal abatement funds that municipalities throughout the state can get as a result of those settlements. Next slide, please. So over the past several years, the Attorney General's Office has investigated companies for their wrongdoing in connection with the opioid crisis. We found that opioid manufacturers used unfair and deceptive sales tactics to promote their opioids to prescribers throughout Massachusetts. We found that opioid distributors failed to implement adequate monitoring systems, and they ignored red flags when shipping opioids to pharmacies across the state. And we found that pharmacies dispensed opioid prescriptions without significant regard for their legitimacy, as they were required to do. And as you know, this led to the exacerbation of the opioid crisis, including by increasing substance use disorder, overdose, and death throughout the Commonwealth. And state records show that from 2009 through late 2021, over 18,000 individuals in Massachusetts died as a result of opioid-related overdoses. And approximately 75% of those individuals filled prescriptions for Schedule II opioids written by Massachusetts prescribers. Next slide, please. So this slide is a chart of the various opioid settlements that the AGO has reached with companies involved with the opioid crisis. And this includes settlements with the consultant McKinsey, Johnson & Johnson, various distributors, as well as the 5 new settlements that I mentioned. And if we are able to finalize these 5 new settlements, we can expect over $900 million in settlement funds to flow into the state for opioid abatement purposes. Next slide, please. So several years ago, the AGO finalized settlements with distributors, including McKesson, Cardinal, and AmerisourceBergen, and the opioid manufacturer Johnson & Johnson. Nearly all Massachusetts cities and towns are participating in these settlements, and that means they're able to receive settlement funds under these settlements. And as of last month, over $42 million from the settlements has been paid to Massachusetts cities and towns. Next slide, please. Late in 2022, the AGO reached settlements in principle with five more companies, including pharmacies, CVS, Walgreens, and Walmart, and the manufacturers Allergan and Teva. And Massachusetts cities and towns now have the opportunity to participate in those settlements. And to do so, they need to sign participation forms by April 18th, 2023. And next, I'm going to discuss a little bit about how that sign-on process works. Next slide, please. So on February 9th, 2023, municipalities in the state should have received sign-on forms and instructions for completing those forms from Rubris, a company that is serving as the settlement administrator. If for some reason you think you should have gotten those forms but haven't, please reach out and we'll do our best to sort that out for you. Next, by April 18th, 2023, if municipalities would like to participate in these settlements and thus receive money under the settlements, they need to sign those forms and return them to Rubris. So in general, municipalities will need to sign and return a participation form for each of the settlements they want to participate in. The one exception to that is for Allergan and Teva, because those two companies have a shared participation form. So for Allergan and Teva, if a city or town in the state would like to participate in those two settlements, they just need to sign that one shared participation form. However, for the other three settlements, CVS, Walgreens, and Walmart, a separate participation form will need to be signed. And as a note, many of you may have been involved with signing forms for Johnson & Johnson or the distributors. Those prior forms are not applicable to these new settlements, and new participation forms will thus need to be signed. And it's important for these forms to be signed and returned by April 18th because prompt sign-on ensures that Massachusetts and its municipalities will receive the maximum amount of settlement funds available. Next slide, please. Next, I'll discuss the abatement funds that are available under the settlements briefly, although my colleagues at DPH will be discussing that in more detail soon. So under our state subdivision agreement, 40% of all opioid settlement funds coming into the state will go to the municipalities in the state. And these can be used for opioid abatement purposes, such as prevention, harm reduction, and recovery. If a town or city receives over $35,000 annually under these settlements, they will need to submit annual reporting to EOHHS. And even if a town or city does not reach this threshold of $35,000, although they're not required to submit this reporting, we're still encouraging that reporting. And if you'd like to see a draft of this reporting form, the second to last bullet point on this slide contains a hyperlink to that draft. And I believe this PowerPoint will be circulated after today, so you'll be able to access that. Next slide, please. This next slide contains some resources from the AGO's website that can help to facilitate the understanding of these settlements, including a frequently asked questions page with details on the new settlements, details on signing on to the new settlements, and details about when you can expect payment under all of the settlements. Also on this page is a link to information such as the maximum estimated annual distributions that municipalities in the state can expect if they sign on to the 5 new settlements, and also the maximum distributions that municipalities can expect if they've already decided to participate with the distributors in Johnson & Johnson. Next slide, please. So this slide contains a link to a page from the Massachusetts Association of Health Boards, and you can find some resources on the appropriation of opioid funds on this page. And we have Cheryl Zabara of the Massachusetts Association of Health Boards with us today. And if you have any questions right now about the appropriation of opioid funds, she'll be able to answer some of those questions in the Q&A portion at the end of this webinar. Next slide, please. And finally, if you have any questions for the AGO about the new statewide opioid settlements, the sign-on process for those settlements, or related topics, please feel free to email us. I believe my colleague put our email address in the chat. So please feel free to reach out. Thank you.
Thank you so much, Greg. I'm going to turn things over to Deborah right now. Deborah, just give me one moment. Okay, Deborah, you should be able to access and speak.
I don't think I can advance the slides, Catherine. Doesn't seem to be letting me.
I've made you the co-host. If you'd like, I can advance them for you.
Yeah, that would be fine. None of the arrows or enter keys are working.
So sorry about that.
So hi, I'm Debbie Wagner. I'm the Director of Accounts at the Division of Local Services, Bureau of Accounts. And today I'm going to go over with you some of the frequently asked questions that were in our July 7th of 22 issue of City and Town regarding the accounting for the opioid settlement proceeds. Next slide. So the first question, and some of these I'll have to rephrase a little bit, but can a municipality that anticipates receiving settlement funds, so we know that there's already been $42 million distributed so far, from the recent opioid settlements, set up a special revenue account to record them? And the answer to that is no. All money received or collected from any source by a city, town, or district belongs to its general fund and can only be spent after appropriation unless a general or special law provides an exception, for example, expressly restricting use for a particular purpose or allowing expenditure by a department or officer without appropriation. And at present, there is no general or special law that provides an exception for these settlement proceeds. And so therefore, statewide opioid settlement funds received by a municipality belong to its general fund. And a lot of people say with regard to the expressly restricts use for a particular purpose, well, these funds do that. But what that means is there should be a special law. For example, I know people are familiar with ambulance receipts reserved for appropriation or PEG access funds. So there would have to be a special law that specifically calls out opioid settlement proceeds, and at present there is not. And is the legislature considering an amendment to create an exception to General Law Chapter 4453 for statewide opioid settlement funds paid to municipalities? And I'm happy to report that in the governor's budget brief, which was released a couple of weeks ago, we expect there to be a supplemental budget filed. And that supplemental budget includes municipal finance language changes. And so we're hopeful that during that process, the passage of that supplemental budget, that wording that we've proposed will be passed and will allow for a different treatment of these funds. Next slide. Can a municipality that received opioid settlement proceeds prior to June 30th of 22 make an appropriation directly from those proceeds for their intended purpose at a meeting of the legislative body? And the answer to that question is no. You can't make any appropriation directly from the opioid settlement proceeds at this point. And funds received prior to the end of fiscal year 22 should have already closed to your general fund. And in the ordinary course, the funds will then be part of the free cash certification by the Director of Accounts. And once certified, may be appropriated. So your free cash as of 6/30/22, which most of you have had certified at this point, if you've received opioid proceeds prior to June 30th of 22, they were certified as part of your free cash certification if they were properly closed to the general fund. And free cash is generally certified in the late fall in most communities. If it's certified by the time you had your fall town meeting, you could have appropriated from free cash for an opioid purpose. And if a town doesn't have a fall town meeting or free cash wasn't certified before your fall town meeting, you could at spring town meeting make an appropriation from the free cash that was certified and includes your opioid funds you could make an appropriation then for an opioid purpose. And likewise, a city could make an appropriation once free cash is certified. But there's two things that I want to point out. One is that although free cash can be appropriated for any lawful purpose, because your opioid funds are in there, you have to make sure that you're using the opioid funds in the manner in which they're intended. So even though they're in your free cash, you still are obligated to use those funds in the manner in which they're intended. And I caution you that because they close to free cash, town meeting there could be a difficulty in getting a town meeting or council to appropriate them appropriately. But we encourage you to make sure that that happens. Next slide. So how can a municipality that receives opioid settlement proceeds after July 1st of 22, so in fiscal 23, use those funds in fiscal 23? So prior to setting your 23 tax rate, if you received opioid funds, you could have made an appropriation for an opioid purpose from your tax levy, from raise and appropriate. And you could have put an offsetting amount on page 3 of the recap under local available funds and miscellaneous non-recurring. And that would have offset the effect on taxation. Keeping in mind that in fiscal 24, you can do the same thing. If you choose to do nothing else with your opioid funds, you can take a vote from taxation, from raise and appropriate for fiscal 24, and put the corresponding amount of your opioid revenues on page 3, local estimated receipts, miscellaneous non-recurring, to make the offset to the effect on taxation. And if a municipality does not follow the above described process, is there anything else they can do with these proceeds in fiscal year 23? So if you receive the opioid settlement proceeds prior to March 31st of 23, which you have, and you've had your free cash certified already for fiscal year ended June 30th of 22, you can request a free cash update. You just contact your field rep at Bureau of Accounts to do a free cash update to include the opioid funds that you've received prior to March 31st of 23. And if the request is approved before the Springtown meeting, your town could then make an appropriation at Springtown meeting or in a city at their subsequent regularly scheduled meeting to appropriate for an opioid purpose as intended under the settlement agreement. Next, please. Can a municipality vote to dedicate to a special purpose stabilization fund some or all of the opioid settlement funds it receives? And the answer to that is yes. However, based on the pending legislation, I'm not sure I would do that at this moment. IGR 17-20 outlines the procedures that a municipality can follow to create and dedicate funds to a special purpose stabilization fund. And the link includes our IGR 17-20, which outlines the procedures for establishing and voting a special purpose stabilization fund and also dedicating the revenue to it. And in there is also sample language to use to set up those special purpose stabilization funds and to dedicate the revenue. And I strongly encourage you to, if you choose to go down that road, refer to the wording in that IGR. And if a municipality receives opioid settlement funds before establishing a special fund, it would need to utilize the processes noted above to appropriate into the stabilization fund after it is created. IGR 17-20 notes the required votes of the legislative body to effectuate these actions. So if you create a special purpose stabilization fund and have not voted to dedicate the revenue to that special purpose stabilization fund, you could appropriate from your certified free cash that contains opioid settlement funds, and you could vote the portion that's the opioid settlement funds into the special stabilization fund. And must amounts appropriated from free cash for opioid remediation purposes be closed to the general fund if they are not expended prior to the next year end? The answer is no. And it's a similar process as when you vote from free cash for a special purpose under a special article at your town meeting or council meeting. You would carry that reservation of fund balance, you would carry that special purpose, special article forward until the appropriation, until the purpose of the appropriation is satisfied. Next slide. And if you have any questions, please feel free to reach out anytime to myself or any of the staff at Bureau of Accounts, or, you know, your field representative or anyone like that. So thank you for having me today.
Thank you, Deborah. Deborah, I'm going to turn things over now to Deirdre Calvert. Deirdre, just one moment. Right, you should be good to go. Any luck advancing the slides?
Nope, I'm gonna have you do them for me. Thank you.
Okay, I'm
Oh,
so
there you
sorry about
go.
that.
No, this makes it easier for me. So thank you so much. As Catherine said, my name is Deirdre Calvert, and I'm going to be joined by my colleague Sarah Ruiz about halfway through. We'll share the slides. So next slide, please. Since Greg did a really wonderful job of kind of setting the table for us around the settlements, I just wanted to start with this other slide. We get asked a lot about the Native American tribes here in Massachusetts and their participation in the opioid settlements. And so I just want to briefly touch on this. So there is a separate settlement for federally recognized tribes. For those tribes, and we have two here in Massachusetts. So for those who are not federally recognized, we encourage and want them to participate as citizens of Massachusetts and members of the Commonwealth in their municipality, in the municipality work, ensuring that we have people with lived experience at the table on all matters. So that's, just wanted to make sure that was out there. So next slide, please. So what are the shared commitments to this abatement? So we want to make sure, as I said, that we have input of our communities, all communities, and people with lived experience. We want to make sure that these settlements address the disparities that are existing in our services and outcomes already, and to improve the health equity of individuals and communities. We want to make sure we are addressing the mental health conditions, substance use disorders, and other behavioral health needs that may occur secondary to opioid use disorder. We want to leverage programs and services that are already reimbursed by state agencies. So including those with direct care reimbursed by Mass Health and our Bureau of Substance Addiction Services. And what we really hope is we encourage innovation, filling gaps and fixing shortcomings of existing approaches, supplementing, not supplanting resources for prevention, harm reduction, treatment, recovery. Next slide, please. So this, I want to take a little bit of time, and hopefully at this point, we've done this webinar a couple of times for different groups, and I want to make sure that people are going to our state subdivision agreement, which is on our website, and that'll be on here too. But I just want to take a few minutes to kind of go through what are some of the strategies. These are not all inclusive, but they are strategies. So number one, opiate use disorder access. And there's 9 pages of this. So I'm just going to touch on some of the things that people can do. So that is supporting and promoting treatment of persons with OUD, opiate use disorder, through programs and strategies that could include mobile intervention treatment, telehealth, recovery services, including peer recovery coaches, supporting evidence-based withdrawal management services and those with co-occurring disorders. This can be used to make capital expenditures to rehabilitate and expand facilities that already offer treatment for OUD. And it could be for treating trauma for individuals with OUD, violence, sexual assault, human trafficking. So 2, supporting people in treatment and recovery. Again, this is not exhaustive. For providing comprehensive wraparound services to individuals with OUD, including job placement, job training, childcare. providing access to housing for people with OUD, supportive housing, recovery housing, rent, move-in deposits, utility assistance programs, training for housing providers, recovery supportive housing. And ensuring that FDA approved medications are always integrated as needed into these support services. That could be used to rehabilitate properties for appropriate low threshold housing, provide peer support specialists. So that is huge. Again, I ask people to look at the 9 pages of options. So for connections to care, this provides connection to care for people who have or are at risk of developing OUD through programs and strategies that include working with emergency medical services, including peer support specialists, post-overdose response teams, connecting individuals to trauma-informed treatment, harm reduction services, primary health care, supporting school-based systems and school-based services related to OUD, having school-based contacts for parents that can engage and seek immediate treatment for their child, support prevention and intervention and treatment and recovery. Funding services and trainings to encourage early identification and intervention for families. Next is harm reduction. So harm reduction, I do want to point out that naloxone is widely available through our CNPP program, through the state, so as our fentanyl test strips. So really looking at bringing a broader array of harm reduction services to the state. And this is to prevent overdose deaths. So providing training and education around naloxone. So that would be one. Doing a naloxone plus, where ensuring people are actually not just getting naloxone, but they're also being linked to treatment programs. Approving and funding syringe service programs and other programs to reduce the harms that are associated with drug use. Supporting the mobile units that go out and offer and provide referrals to harm reduction services. Training healthcare providers on how important harm reduction is and needed. Outreach. And then the 5th one is meeting the needs of the criminal justice involved persons. So having programs that connect individuals in the criminal justice system upon release to OUD programs, and programs such as our reentry program for Black and Latino men, co-responder programs, public safety led diversion strategy programs such as the LEAD model, which is law enforcement assisted diversion, and even participation in membership such as PARI, which is police assisted recovery initiatives. For supporting pregnant and parenting women and their families, looking at programs like First Step Together or Moms Do Care, which are 2 great programs that provide care for women and families with children with OUD. Supporting pregnant, pregnant and postpartum women and family residential treatment programs. And then the last one is prevent the misuse of opioids and implementing treatment prevention education. So supporting programs, policies, practices that have demonstrated effectiveness, supporting community coalitions and developing and implementing comprehensive strategic plans for substance misuse, and engaging in robust multi-sector coalitions for stakeholders. Again, I suggest and highly recommend that municipalities go and look at the state subdivision agreement. There's 9 pages of ideas. We really want this process, though, to be led with the voices of those with the lived experience. And so I can't kind of emphasize that enough. So next slide, please. So when you get these funds, there's going to be a responsibility for any municipalities receiving more than $35,000, whether that is a loan or pooled, to submit reports. And you can get all of the information that you need through the guidance for municipalities utilizing these through our DPH website. You can also go to our AGO website, and also get information on that. The next slide, please, actually has a draft form of what we'll be looking for. Oh, no, one before that. Yeah, there you go. So which is going to ask, how you decided to spend the money, and what was your process with having communities involved and community involvement and people with lived experience. Again, this is a draft, so keep coming back to our website for updates. And then the last slide before I turn it over to Sarah, this is just a visualization of our state. The colors do not represent anything. They're just really pretty. We just want to make sure that all municipal and annual reports will be publicly available, and there will be an interactive map for full transparency. And with that, I'll turn it over to my colleague, Sarah Ruiz.
Thank you so much, Sarah. I'm attempting to
Hello.
make you a co-host, but maybe not with success. So
Okay.
one moment. Okay. If you can't advance it, you should be able to, but if you can't, let me know and I will advance them for you.
I'll have you advance them. Advance it. I don't see the little arrows right now.
All right.
Well, hi, everyone. I'm seeing in a couple of our slides that the formatting is a little off, so unfortunate Hi, everyone. I'm Sarah Ruiz, the Deputy Director of Strategy and Community Health at Bureau of Substance Addiction Services. Great to be here. My portion of the presentation this afternoon is about the resources that BSAS has available and support for municipalities in these efforts, and along the lines of what Dee was just describing in terms of all this range of strategies. We want to support you in this process. We are in the process of contracting with the vendor who's going to be available to help us and all of you with the stages of this work in terms of community engagement, strategy selection, implementation, from that wide range that Dee just described. I'm thinking that we want to support you in a process of really saying what's already exists in your community, what are the gaps and needs, really based on input from people of lived experience. And this vendor will be available to help also with technical assistance around particular strategies, maybe convening groups that are doing similar strategies, helping with groups of clusters of communities that want to work together. So they'll be coming on board shortly. At the bottom there, it's the same link that we've been sharing. That is our DPH webpage for guidance. It says there to go there for updates. And so there'll be more information available there as this process unfolds. The other thing that we want to make available is connections to regional local contacts for people, for help with convening people with lived experience locally. That's what I'm going to focus on right now is the contacts and the coordination that we're beginning to make available to support municipalities. So if you can go to the next page. Next slide. There we go. These are the community engagement partners that including BSAS staff and BSAS funded organizations that we are starting to work with to form regional teams. These working with these groups and they are all available to help support municipalities with soliciting input from people who've lived experience locally. At this stage of the process, we know that many of you were still talking about how the money is appropriated, that there's planning stages. We know that many municipalities are still at the planning stages. I want to encourage you to hear from impacted people in your communities about the best use of the funds. We've been hearing just how meaningful these funds are. And in fact, I want to thank our partners and our colleagues at the Attorney General's office for their advocacy and their work on this topic. It really is meaningful to all of us directly impacted by the opiate crisis, that these funds are coming as abatement to the harms caused. And people feel a lot of ownership, as they should, that these funds are coming for this purpose of really addressing the needs of in the community and the needs of the people most impacted. So we see our role at the Bureau of Substance Addiction Services in helping to support that connection between directly impacted individuals and municipalities, as well as the statewide fund. There's also funds. We're focused right now largely on the funds going directly to municipalities. There also is a statewide pot in which there's opportunity for participation in how those funds are spent. But we have a network of peer recovery support centers that's indicated here, that we currently have 27 around the state, and that network is growing. There's more coming, that have centers around the state that are great convening locations for people with lived experience. We also have a strong partner in Mass Organization of Addiction Recovery, who has a statewide presence in terms of organizing a recovery community. So they're a critical partner, as is Learn to Cope. And from Learn to Cope has a network, as many of you I'm sure are familiar, network of meetings statewide that are support groups for family members of a loved one with a substance use disorder. And they have also a network statewide, as does SAD-OD, which is another organization statewide, support after death by overdose. They are providing bereavement support and working also statewide, providing with people who've had a loss due to overdose. So these groups here represent people directly impacted. Now these were starting off by and endeavoring to bring all of us together on how we can support municipalities. And we're going to continue to bring in more partners, including harm reduction partners, other smaller local community-based organizations who can also participate in this process. So if you go to the next slide, we are forming regional community engagement teams. These are teams that are going to be available for any municipality to contact. So can you help us host a forum, do a survey, whether it's online or in person, some way of reaching people in your community that have lived experience through these networks that we have. And we're going to continue to grow these teams that we have access to people around the state who would love to participate, and they're reaching out to us and asking how they can participate in giving input into locally. So we're going to have regional teams available to help coordinate input and people locally. And as I'm saying, we're going to continue to add. So even if you have, many communities have an opiate task force, they have grants, there's state grants, federal grants, a lot of work happening in this area. We still encourage you to tap into this network as far as people, making sure you're reaching a wide range of people with lived experience in your communities who may or may not be at the table currently, may not have many people with lived experience or living expertise at those tables. So we are available to help you with convening people, and we can try a variety of methods, such as I'm saying, whether it's a survey or an online meeting or an in-person meeting or forum. And this, we haven't really alluded to, but this funding, we've started to receive the funding this year. This funding is going to be coming in payments over the next 18 years. This is a long-term endeavor together. The 900 million that's been referred to is coming over the course of years. So this is something we can build together over time as we really deepen and grow these networks and really allow the most impacted people to have a voice. So if you go to the next slide, we're starting to show who are the current leaders of these teams that are available to support municipalities around the state. So for example, in Boston region, which includes Boston and some contiguous communities, there you have Danielle O'Brien is the contact. And so we have some identified partners, including in each case, we have a lead staff person from Bureau of Substance Addiction Services, somebody from our recovery support services team and our community engagement teams, partnered with somebody from MORE. As I said, Mass Organization Addiction Recovery, a statewide network of recovery community organizing. They are partnering and have these teams already identified, representing recovery support centers, representing Learn to Cope and our other partners, and we'll continue to add. So you can contact Danielle, or you can contact Andrea McConey for the Northeast region, and we'll work with you on how we can help facilitate that input. In the next slide, we have a couple more of the teams in both the Metro West region. Now, these are the public health regions that we use in the Department of Public Health, and we can you can reach out to any of these folks as far as help around organizing some input. So for the Metro West and the Southeast, Michael Bryant is the contact for those. So you can reach out to him and he'll help with our partners to support you in this effort. And the next slide, we have the central and western regions, which Debbie Flynn Gonzalez is the lead on those. On that, the vast region of the state at this point, central and western Mass. Now, just we're having BSAS staff will be the primary point of contact at this point. They will then triage, work with these statewide organizations to put the word out, really pull people together. We have access to these wide networks of people around the state. I want to encourage you to partner with us and to tap into their expertise and their knowledge and experience as far as what's needed at the local level, and provide that opportunity for participation and input that people really are looking for with this. So if you're interested in being part of one of these teams, as far as if you're part of an organization that can pull in people with lived experience in your area, you're welcome to contact us, either one of these emails, or if you go to the next slide, we've been putting out a number of different emails. The next slide, we have the DPH inbox, which is DPH Muni opioid abatement queues at mass.gov. So for municipality opioid abatement questions, that is a inbox that we monitor here at BSAS. You can contact us there if you're interested in participating locally and in helping to convene that living expertise. And we'll be continuing to put updates at our guidance page, which we've referred to a few times already. At that guidance page, we have a number of other links and resources available, and we'll continue to put updates. That is our last slide. That's a focus on for today. So we look forward to partnering with all of you on as this unfolds.
Thank you so much, Sarah. Sarah, I'm going to turn things over now to Sean Hayden, who's the Vice President of Gamma. Sean, you can go ahead and start, and I will highlight you for the team. But Sean, we're not using any slides, so Sean will just be able to speak to you directly.
Okay, great. Well, thank you for having me today. And I guess I'm here to talk a little bit about a regional agreement that our organization has come up with several area towns. And I'll start off by saying a lot of the credit for this agreement goes to State Representative John Zlotnick. John came to me many months ago when the news first kind of came down about the way these settlements would be structured. And he was just looking to brainstorm on ways he could help guide and advise the towns that are in his district. And when we looked at the district and we look at the way the funds are going to be distributed annually, we had a wide disparity of distributions. You know, we have Gardner's sort of our population center here in our region, and you know, they may get an average annual distribution of maybe 30,000, but we also have some small towns that are getting annual distributions of $1,500 or $1,600. And we shared a similar concern, was that if a town got a $1,500 per year, then there wouldn't be too many opportunities to be cost effective or utilitarian with such a small amount of money. So we started to speak to different town officials. We spoke to first responders, and then we went to our local peer recovery center, Alyssa's place here in Gardner. We spoke to the recovery community. We reached out to parents of people, you know, who have either passed, or parents who are working with their, you know, family members who are struggling today. We got input from a bunch of people, and we kind of took an inventory of what exists in our region now, what's missing, what would we love to have, and we kind of looked at that list, and we settled on a you know, a regional program that hopefully would serve all the towns. And the towns in our agreement are Gardner, Winchendon, Westminster, Ashburnham, and Templeton. And what we settled on was the idea of a regional recovery support navigator. Recovery support navigator, you know, for anyone who doesn't know, that's someone who's a sort of a paraprofessional, bachelor's level clinician who can work with an individual and kind of help assess where they're at and identify what their needs may be, what level of care, if they need care, is appropriate for them. And then they can also provide sort of outpatient case management to work with someone to help them access whatever whether it's a service or an introduction to the recovery community or whatever else they might need. The way our agreement ended up working out, it was really interesting because we have several, within that list of 5 towns, there's some different types of government involved, which presented some challenges. Gardner is a city and they have a city council, and most of the other towns are towns and they have a board of selectmen and a town meeting process. So it took several months to kind of hammer out what would be the best way to get all these towns together and agree on how to do this. And where we ultimately ended up was the towns all agreed to sign individual contracts with our agency and have our agency act as sort of a fiscal sponsor for their funds. And the reason was that was easier than every town getting together every year trying to create agreements amongst one another. We would sort of be that central organizing component to the region. And then it also allows them to, it allows a little bit more flexibility with the funding so that we can take those funds and if you don't know, some of the funds were front heavy. There's a couple of years that were paid out early and then other funds will be distributed over, and it ranges on some of these settlements. It could be 30 years on some, and I think the newest settlement, all the agreements are slightly different. So it allows them to essentially appropriate the funds to us as a fiscal sponsor, and then we can budget the funds as the towns ask us to, but it allows us to carry over funds from fiscal year to fiscal year. So we can be a little bit more focused on how the towns want their money spent and not have to worry about, we have to spend all this money in one fiscal year. And it seems to be something that worked out for each of the towns pretty well. And each of those towns also had input on, they all agreed to have this recovery support navigator available to their town. And that person can be accessed by, first responders. If they know someone needs service, the school system can reach out, the health department, anyone in the town can reach out to us and we can dispatch that RSN to the person in need. But in addition, each town kind of had some little carve outs, some preferences for other things we could do with their money. Some examples are Ashburnham and Westminster have a regional school district. So they have requested that the RSN actually have office hours in the high school, 4 hours per week. So that's going to be someone who's going to be in the high school. It's a recovery professional. Students can either access by appointment, by referral, or just drop in. And it's someone who's not, not a member of the teaching staff, not a member of the administration, but someone who's just there to provide recovery support. In Winchendon, they asked us to set up office hours at their CAC, their local food pantry, which is a place that a lot of people in need might access organically already. And also they asked us to do some things like help offset some of their costs related to their prescription drug take back program. And so we worked with each municipality to kind of assess, what they were looking to get out of this. We worked with the local communities, the actual people in the community, the recovery community, or people affected by substance use. We got their input. And to date, this is sort of the solution we've come up with. Like I said, they're not the easiest agreements to put together because you're dealing with different towns, different stakeholders, different types of town government or city government. But we've managed to make it work. The other thing that by working with an agency as a fiscal sponsor, it created some additional flexibility. So even if a town had enough money to say employ a 1 FTE RSN, that's one physical individual who would be responsible for all this work. By partnering with us, they actually access a team of recovery support navigators. And so that allows us to pair the RSN who best matches the preferences and needs of the individual who needs support. So, it also gives us some more flexibility on scheduling, on weekends, on evenings, on different things. So really what they're doing is they're funding 1 FTE, but that could be 4 physical people who are involved in that process. So it was kind of the most dynamic solution we could come up with that would fill most of the gaps that were identified by the various stakeholders in the process. And it just kicked off recently, but so far so good. I'm really excited about the work in the high school happening. I think that's a fantastic choice by Ashburnham and Westminster. And if they choose to expand the agreement by, involving the second set of settlement funds that are coming down, I hope the other municipalities will consider, adding that to sort of the service that they would like to see take place. So, that's kind of a brief synopsis of what we're doing here in North Central Mass. And, we're excited about it. We didn't know that we'd stumbled upon something that other folks might want to hear about, but I'm happy to be able to share what we're doing and answer any questions I can for anyone who's interested. Thanks.
Thank you so much, Sean. And thank you to Rig, Deirdre, Sarah, and Deborah. This has been great. I'm going to do 2 things right now. I'm going to stop the recording so we can move into a Q&A. Just give me one moment here.